Hi, I'm Dr. Adam Eyre from Frontier Pediatrics here in Twin Falls, Idaho, and I'm here today to talk with you about allergies, eczema, and asthma. Now, we all know that March, April, and May are the big months for allergy season. And we want to help you know how to navigate that. A lot of times we think, well, is this a cold virus or is this from allergies? Well, if your symptoms are going on longer than 2 weeks, you're not having a fever, and it's predominantly more of a clear runny nose based rather than a purulent green, yellow runny nose, then you're probably dealing with allergies, particularly if you've got some itchy eyes going on there with it as well too. Of course, you want to try to identify what the potential trigger can be. So watching your child, hey, is it always when they go over to grandma's house and they're around the dog? Is it always when they go outside and play in the grass? Could it be when your family or friends bring over flowers to the house? Is it always when you go on this specific hike in this area of town, but not in this area of town? Things that you can do at home when you notice these symptoms are, of course, avoiding the allergen or the allergy trigger that you think is going on. But there's also great over-the-counter allergy medicines, including Zyrtec or Claritin. From 6 months to 2 years old, you'd take half a teaspoon of either children's Zyrtec or Claritin. From age 2 years to 6 years, you'd take 1 teaspoon. And then for kids over age 6, you'd take 2 teaspoons or just an adult tablet. Under 6 months old, I would avoid treating your child with any allergy medicines. The antihistamines will cover you for most of the symptoms. However, if you're finding that it doesn't seem like it covers your symptoms well enough, then over-the-counter Flonase or some other intranasal steroid can be beneficial. That's going to really block much more than just the histamine pathway that Claritin and Zyrtec take care of. That's going to calm down all the mucous membranes and help it to secrete less mucus, and in general give you a much longer benefit. If that's not working for you, then please come and see us or consider being referred to an allergist for further allergy testing. Because if there is something that we can identify that can be removed from your environment, then that's wonderful. That's the best allergy treatment there is out there. So if you're not being well controlled with your allergy medications, then it's a great idea to get allergy tested to be able to figure out, hey, is there a way I can reduce my allergy burden so that I can contain this within my own self? So if that sounds like you, please come in and visit with us. Let's make sure we're maximizing what we can do at home and over the counter, and if needed, we can refer you to an allergist. Next, let's talk about eczema. Eczema is awful. It's this itchy, thickened, rough skin that can affect you at all different ages. In babies, we tend to see it more on the cheeks. As you tend to grow into the elementary school years, you'll tend to find it in the creases of your elbows, behind your knees. The best way to treat eczema is with moisturization. There are lots of different over-the-counter moisturizers that can be beneficial, but you want to look for one that doesn't have color dyes and doesn't have any perfumes in it. Those ones tend to be the ones that tend to trigger people with eczema. Some brands that you may come across: Aveeno, Aquaphor, Cetaphil, Eucerin, even plain Vaseline. Some mamas tell me that they like to use just plain coconut oil. That's great as well too. If moisturization applied twice a day does not give your child enough benefit to relieve their itching, then you want to start adding a topical steroid cream. The most common one you'll find over the counter is good old 1% hydrocortisone cream. The best way to use that is to apply it first. Apply that to any areas that are rough or itchy. Put that on first and then cover it with a topical moisturizer, whichever your favorite one is. And do that twice a day until the skin is smooth and itch-free. Then stop using your topical steroid, like hydrocortisone, and continue doing the moisturization twice a day. Because you're going to be feeling your child's skin and putting on the moisturizer twice a day, you're going to become aware if it starts to become rough and itchy, and then you're going to jump on it again with your hydrocortisone to help clear it up. So it's okay to use that hydrocortisone or other prescription that your pediatrician prescribes as needed just to calm down the flare-ups. How does eczema play in with allergies? Well, it follows along the same type of pathway. When your allergens are getting flared up in the spring or summertime, then your eczema often flares up as well too. If you can get your allergies well controlled, your eczema oftentimes calms down. There is also a lot of people who have wintertime eczema, especially here in Idaho, because of the dry, cold weather. So moisturizing yourself can help keep that away as well too. If you are finding at home that you are not controlling your child's eczema well enough with over-the-counter hydrocortisone and your favorite moisturizer, then please come in and see us. There's other things that we can prescribe that can help your child get in better control. Let's talk about potential food allergen triggers that can set off your child's eczema. The most common food trigger is actually dairy products. If your child's eczema is not well controlled, despite what you're doing at home, and your child loves to drink milk or cheese or yogurt, you might consider trying off some dairy products for just a week or two and see if your child's skin gets better. If it does, maybe it's a fluke. Add it back in and see if the eczema gets worse. If it does, then that just kind of confirmed it to you. It's always great if you can find out what a trigger is for your child and then use less medicine, because the less medicine, the better. Now let's talk about asthma. Asthma is one of those things that tends to flare up also in allergy season in March, April, and May. The main symptom of asthma is going to be difficulty breathing that's manifested by repeated coughing and wheezing. Now, if you ever have had concerns about whether your child has asthma, then the only way to get that diagnosed is by visiting with your doctor. There are different classifications of asthma. The most mild is considered mild intermittent asthma. And that's the type of kid who just has an albuterol inhaler that they just use as needed, whether it's triggered by cold viruses or it's triggered by their exercise or triggered just during their allergy season. And that's okay to use your albuterol inhaler as needed for those things. The best way to treat your child if they have this mild intermittent asthma is giving them 2 to 4 puffs of their albuterol inhaler through their spacer device. Remember to always use your spacer device. That's the best way to get the medicine down into your lungs. You can use that 2 to 4 puffs every 4 to 6 hours as needed. If you ever find that your child is not responding after a couple of rounds of that, then please make an appointment with our office. We want to help you get your child's asthma in control. If you find that your child is using their albuterol inhaler more than 2 days per week on average, that's pretty poorly controlled asthma. And we'd want to see your child in the office and help them get into better control with some other medicines or other prescriptions. So you may be questioning whether or not your child has asthma. Here are some tips of how to recognize it. Number 1, there generally is a strong family history association with asthma, along with eczema and allergies. If your family tends to have allergies, eczema, some other people with asthma, there's a high likelihood that your child can have asthma. Now, how is that going to manifest in your child? Well, they're going to manifest with difficulty breathing, shortness of breath, less exercise tolerance. If you say, hey, I feel like my child used to be able to run all over the place outside, and now he's coming in super soon and just feeling like he's having a hard time breathing, then that could be a sign. Children may complain of chest tightness, like it's too hard to breathe in or it's too hard to breathe out. They tend to have a harder time recovering. You may think, well, did my child just run really hard today? Well, generally they're going to recover in a normal period of time, but if you feel like, man, my child is just not recovering like they used to, then that could be asthma. If you happen as a parent have asthma yourself and you are worried if your child has asthma, it is okay in an urgent situation to give your child a couple of puffs of your own asthma inhaler and see if that helps them to feel relief. If it does, then it's likely asthma. But we would still want to see your child and help you make that diagnosis. Signs that it would be crucial for you to bring your child in for an evaluation would be if they are looking scared with their breathing, you are feeling scared as a parent, take a look at their chest. If you're seeing them have what we call retractions, where their chest wall is sucking in a whole lot and you're seeing their ribs show up with each breath, you're seeing notching above their sternum, you're seeing belly breathing where you see their ribs showing up underneath with each breath. Those are all signs that your child is using extra muscles of their chest wall to really try to move the air in and out. With relation to your asthma, eczema, or allergy needs, we are always available to help you and assist you with that. Again, we want to keep your children healthy, happy, strong, and thriving.